Right, some dramatic figures came out yesterday. A big drop in HIV infections among gay and bisexual men in England, a 21% drop in 2016 over 2015. Most of that is in London. Public Health England called it the most exciting development in the UK HIV epidemic in 20 years. It's actually not just chance or magic, and it's not just PrEP, the administration of a drug that prevents infection. The UK has adopted some strategies that have been working in San Francisco, and they are apparently working here. James Clayton went to the city, which is aiming to eradicate new infections among gay men altogether, to see what it is that's worked.
If you're going to San Francisco.
By the late 1970s, San Francisco, known for its liberal politics and free love, had become the gay capital of the world. And in Harvey Milk, it even had America's first openly gay elected politician. And then everything changed.
I was working in the hospital. Half of the patients that we were caring for were patients with AIDS. And when I would walk to and from work, I would just see it was devastating. People were emaciated, that you would see them one week, you wouldn't see them the next week. People were losing tens, dozens, hundreds of people that they knew were dying or had died.
It's easy to forget just how bad the HIV/AIDS epidemic was in San Francisco. Over a 15-year period, thousands upon thousands of mainly gay men lost their lives to the disease, until a treatment was finally found in 1996. 20 years later, and quietly, another revolution is happening here. San Francisco is aiming to have zero, that's no new HIV diagnoses, by 2020. Places like Strutt's Clinic in the centre of San Francisco's gay heartland in the Castro are at the forefront of the fight against HIV.
One of the reasons we actually have a big glass storefront, so you can actually see people who come in, you can see people who are going out. And the idea is that when you have that, you show that it's okay to come in here and to get tested. You don't have to hide the fact that you actually got chlamydia. You don't have to hide the fact that you went to a sex party with 20 people. We celebrate you for who you are.
Part of the strategy here is to remove the stigma of getting tested, as early diagnosis of HIV means early drug treatment. But the big innovation here is pre-exposure prophylaxis, or PrEP, which can prevent those taking it from contracting HIV. The Director of Public Health in the city likens PrEP to the drug developments of the 1990s. Do you think PrEP is comparable in terms of...
I do think PrEP is comparable. I think PrEP is this enormous breakthrough, not only in protecting against HIV, but improving the health and well-being of people, because for the first time, they can have sex without being scared about contracting a potentially fatal disease.
In San Francisco, new HIV diagnoses has fallen by 90% since the mid-90s. And for the last 5 years, it's fallen by 50% to 223 cases. Compare that to the rates in the UK for gay men that have been increasing until last year. Figures released yesterday show a 21% reduction in new HIV diagnoses in the UK, fueled by a 29% reduction in London. Clinics like London's Dean Street told Newsnight they've been copying what San Francisco has been doing, but there's one very obvious distinction. The difference between this clinic here in downtown Castro and any clinic in the UK is that here you can walk in and 90 minutes later you can walk out again with a free prescription of PrEP. That simply doesn't happen in the UK. The NHS is about to launch a trial on PrEP, but as it currently stands, PrEP is not available on the NHS. Many gay men buy their PrEP online, but not everyone can afford to.
The fact that it's not available to people in England free of charge is crazy, and it's not right.
So are these drugs changing attitudes towards HIV?
It's very open. People will be like, hey, do you want us to hit up? And you'll be like, what's your status? And they'll be like, oh, I'm negative, I'm on PrEP. Or someone will be like, I'm positive, undetectable, it's safe if you want to do it.
I'm HIV positive, and so way back there was a real fear of anyone knowing because there was a big stigma associated with it. I think now it's viewed much more like any other chronic disease.
But this new freedom has also led to concerns that PrEP could encourage riskier sexual behaviour. Do you think there's more condomless sex, do you think?
Yes, it is. Especially around here, it is a lot of condomless sex because people have a lot of trust on being on PrEP.
So far, although trials show PrEP does result in more condomless sex, there hasn't been a marked rise in STIs. But more research clearly needs to be done. London is looking to copy San Francisco, but not everything is working here. HIV diagnoses is falling in the gay community, but just look at the rate of decline in white men. Among other ethnicities, it's falling much less quickly. People who find themselves homeless now make up nearly 15% of all HIV diagnoses in the city. It's 8 a.m. and 6th Street's Harm Reduction Clinic in San Francisco's much less affluent Tenderloin area is preparing to open its doors.
Everything here is part of either safe sex, safe smoking, or safe injection, and everything here reduces the risk and transmission of HIV and hepatitis C.
But despite needle exchanges like this, the Getting to Zero initiative is not making the inroads it hoped for.
We've seen a drastic decrease in new HIV transmissions amongst white gay men, right? That was the first population we outreached to. That was the first visible population that was affected by HIV. And so they did massive amounts of outreach. And what happened was we left behind everyone else that was vulnerable to the disease.
That report from James Clayton. Well, joining me now is Kate Harrison, who's head of programme funding for AVERT, which is an organisation that works to educate and inform people about HIV. So we've seen a big drop in London, particularly in London. How easy would it be for the rest of the UK to copy what's happened in London?
Well, in London, you've got a very concentrated population. You've got fantastic services like the Dean Street Clinic and other clinics that are really providing services to the majority of gay men who need them in London. I think in cities, it'll be easier to provide those services. The more scattered populations outside, more difficult.
And what is it that's driving it? So one theory is it's all PrEP. It's the treatment that's relatively new. And it is interesting that the graph comes down at about the time PrEP appears on the scene. Or earlier treatment that makes people less infectious.
PrEP is a game changer, there's no doubt about that, and it's really important. And I think one of the things we should say is that gay men are the heroes in this story because they're the ones that have been championing PrEP and getting PrEP for themselves.
They've had to buy it, basically.
They've had to buy it, but they're doing it. And sites like I Want PrEP Now are really important for gay men to get access to the prevention that they need. But yeah, earlier treatment, earlier testing and earlier treatment is also really important. And that's also actually been driven by the communities who are saying, let's be open about this, let's get to the clinics. And the clinics have provided the services where they need them.
And so you do actually need clinics. And it's easier in a city where you can be near a clinic than in the countryside. Yeah. Right. Now, other communities, this is the point James was making in the piece towards the end, there hasn't really been a drop. Presumably PrEP would work in those communities as well. So how easy is it going to be to take it from gay men going online, buying this thing, or getting tested every three months so that they know that they are going to be treated as soon as they could be if they're infected? How easy is it to get that over to some of the other communities?
So one of the big differences for gay and bisexual men is that they know that AIDS isn't over. The people outside that group, people I speak to who are not gay or bisexual, sometimes think that, HIV is in the past. So what people need, first and foremost, is education. They need to know that they're still at risk. And knowledge is really important.
But you also need a life that's not... You need to be looking after yourself, don't you?
Well, there is
because you need to be a bit motivated. And you may need a little bit of money as well, because if you're having to buy the PrEP, you probably need to be able to get together 20, 30 quid a month or something to pay for it.
You shouldn't have to buy PrEP.
No.
PrEP should be available for free.
And it's just going... It's been okayed, but it's...
Well, the Scottish Government are providing PrEP for free. There's a very good public health argument for providing PrEP for free.
Tell me about the African diaspora and how the issues there, because many people come from Africa, they don't know they're infected actually, do they? So they could be, infected for a long time before they realise.
They could be, although a recent study has shown that migrants are more likely to acquire HIV in Europe than to be coming with HIV. So I think there's a bit of a myth that people are coming to the UK with HIV.
Tell me how, the goal is, particularly in San Francisco and I think in London too, eradicate new infections among gay men by 2020.
That'd be fantastic.
Is it going to happen though? I mean, is it possible? Presumably there'll always be some at the edges, won't there?
Well, there are always people who are in the most marginalised groups. They mentioned homeless people on that film, and there are always going to be people that are really in the margins. You have to be able to provide services to everyone, and sometimes it's not cost effective to do that. But I think it's fantastic to have a bold vision. That's one of the things that I'm so impressed with the Mayor of San Francisco doing.
Kate Harrison, thank you very much. Thanks.
Thank you.